welcome to another episode of the DunnWisdom Morning Show. We are so grateful to have another week of life, another day that we can say we are here, we are well, and we have the opportunity to put our best foot forward. My name is Melissa Dunn. I am the CEO of MD Marketing Network, the founder of DunnWisdom, and a candidate for Lauderhill City Commission, seat number 2. Woo, woo. If you haven't voted yet, make sure that you go ahead and make a plan to get to the polls. Early voting starts, I believe, next week in Florida. So let's get it done, y'all. So today is a really special day for me. If you guys have been watching this show, you know that one of the healthcare causes that's near and dear to my heart is cancer prevention. And so this week, we are really dedicating it to breast cancer awareness. This is October after all. And the second thing that you probably know about me, if you've been watching this show for a while, is that I'm a member of Black Girls Run. Well, Black Girls Run has formed a partnership with the Gilda's Club, which is one of the organizations that I love and have collaborated with in my career. And so today we are going to be kicking off Breast Cancer Awareness Week on the DunnWisdom Morning Show. And how perfect that we have with us today someone who is not only a part of the leadership team of Gilda's Club of South Florida, but she's also a member of Black Girls Run. So, ladies and gentlemen, put your hands together, drum roll, please, for our special guest today, Miss Belinda Paulicin, who is the Director of Programs and Services at Gilda's Club of South Florida. Hey, Belinda, welcome.
Hi, Melissa. Good to see you again.
Oh my gosh, it is such a small world.
Yes, it is.
I remember us connecting through BGR when you first came down, like about 2.5 years ago, right?
Yes, actually, we connected about 2.5 years ago. I've been a member of BGR probably about 5 years. I joined BGR when I really wanted to just get back to being healthy. And although I would working out alone was not the same as when you have group support. And so we were able to meet and run a few times together and so on. So it's been a wonderful experience and journey.
Oh, fantastic. I'm so excited about this collaboration, this partnership between Black Girls Run of South Florida and Gilda's Club. Before you tell us about the partnership, why don't you tell us a little bit about you and Gilda's Club?
Sure. So I'm a clinical social worker. I've been in practice for well over 25 years, and in South Florida, about 13 years of that. I joined Gilda's Club actually 2 years ago in October when I really wanted to make an impact around health. And looked at so many different areas, especially pertaining to cancer. It had become an issue that so many friends and family have been impacted by. And I understood the need for support. And so I joined the organization to really join our CEO in her vision of reaching as many individuals impacted by cancer so that they are not facing cancer alone. We provide 5 core services. We provide support services, so support groups, individual counseling specifically around cancer. We have our healthy living program, again, something very dear to me, where we stress the importance of a healthy lifestyle to be able to help one as they go through cancer treatment and also beyond cancer. And we also have our educational component. And that is also the opportunity where we're empowering individuals with information so that they can make informed decisions in terms of their treatment options. But also our education focuses on talking about prevention, looking at risk factors, raising awareness, and that's where the women of color and partnering with VGR has come into place. We've also done several educational programs within the schools called Kids Can, really talking about cancer awareness, really encouraging kids, to understand the impact of smoking can have on you, importance of sunscreen and so on. So we do quite a few of working in the community through our education programs, and also bringing experts in who are around the latest information, research, treatment options, to educate the community and empower them with that information.
Okay, fantastic. Thank you so much for that overview, Belinda. Gilda's, hey, good morning, Miss Joy. Thank you for tuning in. Thank you for tuning in for sure. Actually, seeing Miss Joy just brought up a question to mind, Belinda. So Miss Joy runs a grandparent group on social media, and she's quite a few grandmas available. Could you just kind of give us a broad synopsis of who should be getting what? What's the protocol for being screened for breast cancer right now in terms of the age and the exams that you should be getting?
Well, one, we speak to your care provider, because depending on various reasons and various issues, as genetics, family history, there may be different screenings, but the important thing is to get screened. Around the age of 20, we're really looking at, clinical examinations every 3 years. Also, self-examination is screening. And then after age of 40, you want to start getting those mammograms. So those things are very important. But what is important is that having that conversation with your healthcare provider, what is best for you, what based on history, based on other risk factors.
Yeah, I know that there's a huge disparity, particularly when it comes to the incidence and mortality of breast cancer for women of color compared to our Caucasian sisters.
Mm-hmm.
Why do you think the disparity exists?
Well, I think the disparities exist along a lot of health disparities. So there's the access. So there's the quick response. We know that the earlier that we can have individuals identify that they have or they're at risk, the better the outcomes. So one of the things we're really working on is getting that early detection. And that's one of the biggest differences. So, where only about half of breast cancers in Black women are diagnosed at a local stage, compared to 64% of white women. So want to start seeing those numbers reduce, want to start seeing women be screened when, and also, again, having those conversations with their healthcare providers, but they need to be going to those healthcare providers. Mm-hmm. So insurance is a big gap, is a big issue. Local community being able to access affordable care is important.
Yeah, I remember, Belinda, this is in the late 90s. I had a really good friend of mine who, we worked my first job together, right? We were case managers at a junior high school in Brooklyn together. That's how far back we go, like right after college. And I remember getting a call one day from her telling me that she was diagnosed with breast cancer. Mm-hmm. And at the time, she didn't have a full-time job. She was temping actually at Beth Israel for a breast cancer surgeon. Like, she was temping for a surgeon at Beth Israel Cancer Center at the time. And she got diagnosed with stage 3 invasive ductal carcinoma. Mm-hmm. And even knowing what she knew, working in the healthcare system, being a very educated, proactive woman that, this is the woman that was like, she has worked in Guantanamo, Cuba with refugees. That's how strong and an activist she was. But the minute she got diagnosed, she became worried about how to pay for all of that.
Mm-hmm. Right.
And so because of that, she really, really delayed making some healthcare decisions because she couldn't afford it. And even though her boss donated his time to take care of, to do the biopsies and all of that stuff, and she ended up having a mastectomy with a reconstruction, and he donated his time, but there's still the facilities fee, there's still a fee for the anesthesiologist and the hospital stay. And in the end, it wasn't a positive outcome.
Yeah. And that's the sad reality that many women of color face. High copays if you do even have insurance, making that choice and decision between your health and taking care of your family. And that's the other thing, women of color, taking care of our family, being strong, being able to keep going. It's almost ingrained in that culture and the thought. So working to prioritize, and then also working with a healthcare system that does make it a lot easier and affordable for women not to make have to make those choices is important.
Yeah, for sure.
Mm-hmm.
For sure. And that's why programs like the one that I ran called the Manhattan Breast Health Partnership and yours is so important. So Veronique says, why do Black women get diagnosed with breast cancer at a later stage than white women?
Again, because of some of those access, also, going to your doctor every year, having those clinical exams in a timely manner. Also, it's a difficult conversation, being aware of the changes in your body and not minimizing them. But for Black women, it's do we go to the doctors when we're supposed to go? Are we getting the mammograms? Are we getting the screenings? Are we engaging in self-care? And then if we do find something, is our healthcare system easily accessible? Are we able to quickly get the care that we need? And those are the things that we're working on. So there's two folds, right? Working, raising awareness within our community. More and more now I'm seeing, I've seen at the clubhouse and around and talking to hospital partners, we're seeing even younger women. And so it's important, you're a young woman to do the self-examination, but also when you go to your gynecologist, having that clinical exam as well.
Yeah, very, very important. And that's why, oh boy, okay, another question. Is it true that cancer is more aggressive for Black women, or is it just that they're detected later?
Well, I would want to say to you, come and listen to our speaker on October 17 and 18, Dr. Sophia George, who's going to talk a lot about some of the research and information, and our nurse practitioner who will answer that. But there are some cancers that are particularly aggressive, and it's more due to genetics, like a BRCA1 and BRCA2. And so there are also some cancers that we call triple negative breast cancer, and it's often aggressive and can come back. And so those are why early detection is important. So knowing your genes, knowing your risks in that way, right. But also knowing that there are certain cancers are just more aggressive than others. So that's why the screening and the early detection is important.
Correct. And that's why programs like, let's just hold on the questions for 1 minute. Give me a chance to get this part out. That's why, and I'm so happy to see people are asking questions this morning. This is fantastic. But I do want to kind of get to the meat of why we're having this conversation today. And that's why prevention programs like some of the breast health partnerships that are around throughout the nation is so important. And that's why here in South Florida, the collaboration between Black Girls Run and Gilda's Club of South Florida is so important. I understand that through the partnership with Black Girls Run, Gilda's Club of South Florida is offering some educational workshops, followed by free mammogram screenings. Could you speak a little bit about that? Give us some details.
Yes. So it was important. For some time, we've been doing the Women of Color educational series, and that's where we bring in an oncology health practitioner who will speak and will address some of the specifics around breast cancer, especially regarding genetics and regarding different types and the different screenings. And so what we wanted to do was not just provide the information, and information is empowering. It's what when we provide it, you know, it's empowering, but you also have to give people some resources. And so we partnered with Florida Mammography Mobile Van to be able to bring a free screening for those women who qualify into the community, so that we reduce the barriers of transportation or access or insurance. So if a woman doesn't have insurance and she's, you know, and we don't look at documentation or anything like that in terms of, you know, I know someone asked a question if they're not documented, but we try to get them free access, and then link them also to community-based healthcare centers that could help with doing some of the follow-ups. And this is it's funded by Susan G. Komen, and we're able to do this and bring that into the community. And it's very important. Again, when we had this program last year, we had so many women that came out, and we were able to assist. We were able to go to LifeNet for Families in the Fort Lauderdale area, where it's a nonprofit organization that helps with food insecurities, and be able to provide some of the women who were homeless and didn't have access to some of that care.
Okay, so ladies and gentlemen, if you're watching this, I want you to make note, okay? And I want you to share this information with any woman that you know right now who may or may not have health insurance. So here are the details. If you are over 40 years old, you have not had a mammogram in a year, October 17th and 18th is a Zoom health education session, right? Would that be correct? A health education workshop that you can attend. We're going to put up the link where you can register. So October 17th or 18th, you need to attend one of these health education workshops. And then you will be able to get screened, get a free mammogram on October 26th or 27th. So it's a two-part opportunity. Okay, you go to the health education workshop either on the 17th or 18th of October. And then after you attend those workshops, you could go to get a free mammogram on October 26th at the Hollywood City Hall, or October 27th at the Ambassador Church, which is located at 2325 West Oakland Park Boulevard. Let's put up that link, Natasha, so that they'll be able to go ahead and click and register. And let's also put it in the comments so that anybody who's watching the replay can click and get registered to participate. What can women expect on the 17th and 18th, Belinda, when they come to the workshop?
So on the 17th, we have Dr. Sophia George. She's from the Sylvester Comprehensive Cancer Center, also a woman of color. There will be a PowerPoint presentation. Again, there'll be lots of information regarding breast cancer, what it is, what are some of the risks, ways to address some of the risk, and in addition to the different types of screenings. She will then have an opportunity for a question and answer. So anyone who has any specific questions, you'll have an opportunity to ask. And then anyone who attends will also receive, if you register and attend, you will receive a $10 gift card for a healthy meal. And then you are able to then answer a quick questionnaire, and then you will get the link to attend the free screening if you qualify. This on the 18th, we have Jessica Jack, who's with Memorial Healthcare System. And she will also do the same, do the presentation around the educational, share the educational information, as well be able to answer any questions you may have. And then again, the same will happen. The individuals at the end will receive their gift card for attending. And again, if they qualify and are interested in the free mammogram, they're able to get a little short questionnaire that they'll fill out with their name and information, so we can forward it to the mammography van to expect them for that day.
Oh my goodness. So not only do you get educated and the opportunity to get a free mammogram, you also get $10 for a good, healthy meal.
Yes, we want to stress healthy meal. We do.
Oh, I love that. So it sounds like a good opportunity.
Food, working out, keeping that balanced life,
yes,
managing stress. And so we'll cover all of those things as well.
Fantastic. And so you can, link to register is in the comment section of this video. So if you're watching the replay, y'all, click on the link. Do share this, because I guarantee you, I don't remember what the statistics are now, but is it 1 out of 8 women?
1 out of 8 women will have a breast cancer diagnosis in their lifetime. That's pretty significant.
That is huge significant. I mean, listen, you're in a restaurant, right? Even with social distancing, if you're in a restaurant and the restaurant has several women in it, many of you will be diagnosed with breast cancer at some point in your life. So,
right.
Yeah, it's a huge statistic.
Right. And what we're seeing is that, African American and Black women under the age of 40 are more likely than white women, so to be diagnosed at a little younger age. So we're trying to really get the message out to young women, that to really talk to your healthcare providers, do those clinical exams when you're seeing your doctor. Make sure you do that annual checkup, those kinds of things, and then doing your breast self-exam, which our healthcare providers will talk a lot in more detail in the right ways of doing those things.
Yeah, this is so important, ladies. And so men, if you are watching this show today, I want you to have a conversation with a woman in your life, be it your wife, girlfriend, sister, mother, auntie, whomever. Ask the question, ask them, what are you doing? When was the last time you had a mammogram, or the last time you had a clinical breast exam, right? Sometimes it takes multiple people asking us, listen, put on your own mask first, take care of yourself so that you can take care of the rest of the people that women typically nurture.
Yeah, and I think that's a big thing for women of color, natural nurturers wanting to, take care of our families and so on. But self-care is taking care and knowing about breast health. It is very much being aware, and also encouraging our daughters, our friends. One of the things they'll say, maybe have your brunch day where you schedule your mammograms, together with your girlfriends, to make sure everyone goes ahead and make it a annual, event if you're over the age of 40 and it's appropriate for you. Do things like that. Make it a priority.
Yes,
just like you would other things.
That's a great point, Melinda. Make it a priority. And I think one of the things, you know, in doing this show for the last, oh my gosh, we're going on 7 months now. One of the things that's become clear from a lot of our guests is that sometimes as women, we do not put ourselves at the top of the list.
Mm-hmm.
And this is just one of those things that we got to make sure that we handle.
We do. And I think that it's always so difficult because we're so busy, got so much going on. But the truth of the matter is, the more we take care of ourselves, the better we are able to take care of the things that are important to us, and that we're important. And so taking that moment, celebrating the opportunity to be able to get screened and stay healthy is important for our community. It's a message that we have to get out there. We have to get out there, not when we're older and after diagnosis, but also when we're with our younger women, with our women in their 20s and 30s, who sometimes, you know, life is happening, but being able to be mindful, knowing your body, knowing, you know, if things have changed, and then addressing them immediately is important.
Yeah. Fantastic. So again, as a reminder, October 17th and 18th, there's a breast health education workshop. The link is in the comments, to do register for that so that you can not only get the education, but also get the $10 gift card for a healthy meal, and also the opportunity to get a free mammogram on October 26th and 27th.
Mm-hmm.
We are happy to take your questions now, so do type them in the comment. So, wow, that is hard for me to read with no glasses. Could you read that for me, please, Belinda?
We are 5 sisters. 4 of us had abnormal breast mammogram. We all completed the follow-up test and were told to follow up every 6 months. Should I tell my youngest sister, who's not 40 years, to get a mammogram? Keep in mind there's no breast cancer history in her family. That's a good question to ask your healthcare provider, and to have that conversation with your doctor. And if you're asking that, you know, if your sister is under 40 and the doctors that are caring for don't believe that that's the case, there's the clinical exam, there's the self-examination. But if you do have some concerns, then again, talk about it with your healthcare provider. We can advocate for ourselves. If we feel that something is wrong, if we feel that we didn't get the right answer, then we can go to other places to also get that answer. But definitely, that's why the women of color and doing these educational workshops are important, because we'll have those healthcare providers who can answer it. But your specific issue and your specific history, your healthcare provider should be able to answer that question. So I would empower you. And it's really good questions, and certainly, you know, doing the follow-ups, if the doctors tell you every 6 months, is important, and making that time to do so. So I'm glad that those of you in your family where the doctor has said that you are doing that.
Yeah, and for those of you who may not have access to a healthcare provider, I think coming to this workshop on October 17th and 18th will help you, because what I'm hearing Belinda say is that not only will you get plugged in to be able to get a free mammogram, you'll also get plugged into a system that can follow up with you. Is that correct?
Correct. So if anyone who's at the Women of Color workshops, what we have done is put together a form, and if there's anyone who indicates that they don't have access to free care or reduced care, we will be able to, you can share your contact information and we'll follow up with you. We have staff and interns who are there to help research what resources are available in your community to help make that linkage for you.
Yes, work that healthcare navigator. I love it. Any resources from Central Florida, especially for undocumented women?
We are located in the South Florida area, so we would be able to definitely look into that. Like I said, we would research that information specifically for that individual. Every community, there's low cost or community center healthcare centers, so we would try to locate and link them to those services.
Yeah. So a quick resource, a place that you can go regardless of where in the US you live. Usually there are federally qualified health centers throughout the United States that receive funding to see women regardless of their documentation status and regardless of their ability to pay. So what would happen is that you can perhaps call 211 in your area, and 211 can give you a list of resources. So that's one area that you can look at. And then the second area is to just go on Google and find out like a community health center. And a community health center, typically, they don't ask questions about documentation, number one. And number two, they charge you based on your ability to pay. And a lot of times you can access free service through a community health center.
Yes, that's correct.
Right.
And 211 is available. Yeah.
Yeah, that was a really great question. And, you know, I don't know what it's like in Florida. I believe that Florida, you guys do have a breast health partnership program here, right?
I'm sorry?
Like the one does Florida have a breast health partnership program similar to the one that I ran in New York? The one that I ran in New York was funded through the CDC, and it provided free breast cancer screening education.
Yeah, there's several free breast cancer screening programs throughout Florida. I know that some of the hospitals even have a certain number of amounts of screenings and different programs. Holy Cross Hospital is one of them that we have also referred. Again, 211 is a great tool. Also, American Cancer Society is also another area where sometimes they will promote if there's some free screenings available. Susan G. Komen is another resource and another partner in the community that has done a lot to help women who have difficulty accessing screening as well.
Yeah, the American Cancer Society is the program, was where I worked in New York, that managed that program. So I guess the bottom line is 211 is a great place to start.
211 is an awesome place, no matter where you are in Florida, that you can ask and get some questions. But I think the important thing is, and we stress this in our Women of Color, women who are undocumented, you know, communicate with us, communicate with the community, and I know that the fear is always there. But just as you said, Melissa, there are the community-based health centers where you are able to access services.
Yeah, fantastic. What a great question. Thank you, ladies, for watching. Do you have any final words of wisdom for our guests today, Belinda?
I'm so glad that you took the time to take care of you just by being here and tuning in and listening. And that's what's important. I think that the Women of Color Initiative, we stress that. We stress the importance of taking the time to take care of you so you can take care of everyone else. So we look forward to seeing you this weekend, October 17th and the 18th.
Fantastic. Thank you so much, Belinda, for the work that you do. Continue to take care of yourself so that you may take care of our community. I appreciate you very much.
And I appreciate you for all the work you're doing in the community, Melissa.
Awesome. Thank you, Belinda. Thank you. All right, ladies, remember October 17th and 18th is a health education workshop. And if you attend that with Black Girls Run of South Florida and Gilda's Club of South Florida, you will have the opportunity to receive a $10 gift card for a healthy meal and a free mammogram on October 26th at the Hollywood City Hall, October 27th at the Ambassador Church parking lot, which is located at 2325 West Oakland Park Boulevard. Thank you so much for tuning in today. This again is Breast Cancer Awareness Week here on the DunnWisdom Morning Show. And I want to remind you to take care of yourself. And if you are a man watching this show, encourage the women in your life to take care of themselves and to remind them how much you love when they are healthy and well. Thank you for watching. We'll be back here again tomorrow, where we will be speaking with a cancer survivor and kind of talking a little bit about her journey to wellness. My name again is Melissa P. Dunn. Thank you for watching. And remember, be kind and loving to yourself today. You deserve it.